So today's our session will be SDS live chat coding pre-demo. Okay. So always I believe on share knowledge, gain knowledge. So if I share my knowledge, I will gain more knowledge. That is my motto. So next about me. So I have nearly 9 years experience in all specialties, inpatient coding, radiology coding, ED and surgery. Currently I am working as a QA analyst in one of the MNC in Hyderabad. Okay, so as we have discussed, I have two YouTube channels. First one is FastCoder21, which is mostly consists of English medical coding YouTube videos. Okay, so SuperCoder21, so which is having Telugu medical coding YouTube videos. Okay, in today's demo session, so we are going to learn hernia repair coding. Okay, so in live coding also you will get the same procedure. So we are using this live scenario for our demo. Okay, so what is hernia, guys? Anyone knows what is hernia?
Protrusion of
Yeah, perfect. Okay, so basically hernia is the protrusion of intestine or tissue through the weak spot in the muscle. Okay, most of the time you will see hernias in abdominal area as well as inguinal area. Mostly 90% you will see in the abdominal area as well as inguinal area. So today patient came in for left inguinal hernia repair. Okay, so whenever you want to code inguinal hernias, first you need to understand few definitions. First we got to know what is hernia, correct? So now we need to understand what are the type of hernias. So basically we are having three types of hernias. Okay, first one is reducible hernia, where physician or patient can easily push back those protruded tissues through into the abdomen. So that is reducible. So using the manual pressure, you can push those contents inside the abdomen. So that is reducible hernia. Okay. So next one is incarcerated hernia. So during the incarcerated hernia, hernia contents are tissues trapped in the hernia. Okay. And patient can't perform hernia repair related to incarcerated hernia. Okay. So next one is strangulated hernia. So here, which is a medical emergency basically. So if the patient is having strangulated hernia, blood supply will be cut off to the hernia. Okay. And which it will become ischemic. So if there is no blood supply to the organs, it will become ischemic, correct? So it is a very complicated procedure. Okay. So like that we are having reducible hernia, incarcerated hernia as well as strangulated hernia. So these are the three types of hernia repairs. Okay. So we will consider this hernia as a reducible hernia. So what is reducible hernia, guys? Any idea? What is reducible hernia? So reducible hernia is a hernia where manual pressure is sufficient to push hernia content inside the abdomen. Okay, so here there is no need for incision, just manual pressure is enough. Okay, so indication. So pre-op diagnosis left inguinal hernia, post-op diagnosis is left reducible inguinal hernia. So what is the indication here? A 78-year-old male with prostate cancer presents for inguinal bulging for the past few months. Hence, today he came in for definitive treatment. Okay, so what is the definitive treatment here? Repair of inguinal hernia. And after the evaluation, patient is found to have hernia or inguinal hernia. Okay, so procedure performed is inguinal hernia repair. So this is the description of the operative procedure. So the patient was placed on OR table in the supine position. So whenever you code surgery charts, position is very, very important, whether it is supine position or prone position. Why means based on the position, we can identify what type of procedure patient is going to perform. Okay. So after induction of, so here supine means face up. Okay. After induction of general anesthesia, IV clindamycin was administered and the left groin was prepped and draped in a usual sterile fashion. Okay. As patient is having the left inguinal hernia, patient has prepped the patient on the left groin area. Why means patient is going to perform procedure in the left groin area where patient is having the inguinal hernia. Okay. So after adequate timeout, the skin above the left inguinal ligament was infiltrated with 1% xylocaine and 1% 0.5% marcaine. So which is for anesthesia. Okay. So here patient was prepped and patient has performed the local anesthesia here. Okay. So after performing or application of local anesthesia, patient has performed the incision. So an oblique incision was made paralleling to the inguinal ligament. Okay. So incision was carried down to the external oblique aponeurosis. This was opened in the direction of its fibers. Ilioinguinal nerve was identified and placed out of harm's way. Okay. The cord structure was elevated from the floor of the inguinal canal and dissected free. Okay. So here patient has performed inguinal canal free. Okay. Upon exploration. So what is exploration, guys? Anyone knows? What is exploration? Yeah, no worries. So basically exploration means examination. Okay. After examination, anteromedial, where it is? Anteromedial to the cord was indirect sac as well as the floor was moderately weak. So here patient has identified the hernia sac. Okay. So wherever you see indirect, you need to understand that patient is telling about the hernia. So this is the hernia sac as well as the floor was moderately weak. As we have discussed previously, most of the time hernias occurs due to weakness in the muscles. Correct? So patient has identified the hernia sac where there is a moderately weak tissues. At this point, the sac was dissected of the cord structure all the way back down to the internal ring. Okay. So at this point, a medium size PHS mesh was used. Okay. So here patient has identified the hernia and he applied the mesh. Okay. The disc portion of the mesh was inserted into the pre-peritoneal space and then the flap portion was placed on the floor of the inguinal canal anchoring to the pubic tubercle, sheathing edge of the inguinal ligament and conjoint tendon. So here patient has performed the mesh and he reduced the inguinal hernia into the abdomen. Okay. A slit was made for the exit of the cord and the nerve was placed back in the anatomical position. Okay. So patient has reduced the inguinal hernia which is in the inguinal canal and patient has applied the mesh. So after performing the mesh insertion, patient irrigated the wound. Okay. So all
Hello?
hemostasis occurred. Hello.
Hello, hello.
So like that patient has performed the hernia repair. So the external oblique aponeurosis was then closed using 2O PDS in continuous fashion. Scrappa was closed using 3O acryl in an interrupted fashion and the skin was closed using 4O monacryl in subcutaneous fashion. So basically these all are suture types. 3O acryl, 4O monacryl, 2O PDS all are suture types. So after performing the procedure, patient must and needs to perform the repair also. Okay, so patient has performed repair after performing the inguinal hernia repair. So sterile compressive dressing was then applied. The patient tolerated the procedure well, no complication. So what is the answer here? So here our answer is 49505 and also we need to append laterality modifier. Okay, so here, okay, now using this scenario, Here our code is 49505. So now you are having the doubt. How did I get that code? Okay. So basically this code, if you use your CPT book, directly you can go to hernia repair. Okay. Under hernia repair, you need to check inguinal hernia. Okay. So after performing the inguinal hernia, you need to check what type of patient's age. Okay. So here our patient is 78 years old. So if you check the code description, repair initial inguinal hernia is 5 years or older, reducible. Okay. So here based on those criteria, we need to understand 49505 LT modifier is the correct answer here. So here now we need to understand what are the important questions related to this procedure. Okay. So whenever if you go to interview, they will ask you, how do you code hernia repairs? Okay. So whenever you want to code hernia repairs, first you need to check location of the hernia, whether it is in the inguinal hernia or whether it is in the abdominal hernia. Okay. Inguinal hernia means hernia is in the inguinal region. Abdominal hernia other name is ventral hernia. So which is in the abdominal area. Okay. Next we need to check initial or recurrent. So initial hernia means first time hernia. So patient is having the first time hernia. Okay. So recurrent hernia. So recurrent means second time hernia. So for example, patient had previously left inguinal hernia repair. Okay. Again patient came in for inguinal hernia repair. So it will become initial or recurrent, guys. So patient had previous inguinal hernia repair on the left side. Again today patient has performed the inguinal hernia repair. What it become? Initial or recurrent? Anyone? So it will
Recurrent.
be, yeah, recurrent. Perfect. So this hernia becomes recurrent hernia. Why means patient had already hernia previously. Again today patient again same location performed the hernia. So today's like for example, so today's hernia will be recurrent hernia, like that. So next you need to check approach. Okay. So in hernia repair we are having three approaches: open approach, percutaneous, or laparoscopic and robotic. Okay. So we need to understand the approach. What type of approach? Open, laparoscopic, or robotic? So tell me what is the approach type, this one? Anyone? Can you try for that? So today we have coded one scenario, correct? What is the approach? Open, laparoscopic, or anyone? What is the approach?
Opener.
Yeah, open approach. Perfect. Okay. So anyway, no need to worry. So during the live session, I will explain you. So how to
Okay,
identify
okay.
laparoscopic approach, open approach, and like what do you call robotic approach?
Okay.
Okay. So now we have identified the approach. Next, we need to identify the patient's age. Okay. So why means hernia repairs are based on patient's age. So we need to check the patient age in the operative report. Okay. Next, we need to check for type of hernia. So total how many types of hernias, guys? We have learned, correct?
Three types.
What are those?
Reducible, incarcerated, strangulated.
Yeah, perfect. So these are the three types of hernias. So in the operative report, we need to check what is the type of hernia. That is one keyword. So using all these steps, you can code hernia repair. So if in the interview they will ask you, how do you code hernia repairs? You need to tell all these steps. So total, like I think 6 or 7 steps, correct? So if you remember all these steps, you can attempt your interview perfect, and the interviewer think that so you are having the live experience. Okay, so like those tips I will tell for each and every procedure during our live training. Okay, so next, so in interview they will ask you, so how, what are the anterior abdominal wall hernias? Okay, so the examples for anterior abdominal wall hernias are epigastric hernia, incisional hernia, ventral hernia, umbilical hernia, and spigillin hernia. So this is one of the most important interview question. What are anterior abdominal wall hernias? So you need to tell all these types of hernias. Okay. Now they will ask you. So how do you code multiple hernia repairs? Okay. So if they ask the same question, you need to tell if the patient is having single hernia, I will check the defect size and I will code the length of the defect. Okay. So if the patient is having the multiple hernias or multiple hernia defects, we need to check the gap between two hernias. Okay. So if the gap between two hernias is less than 10 centimeters, we can combine and code. Okay. If the gap between two hernias is more than 10 centimeter, we need to check the, we need to code individually. So that is the guideline basically. So what is the key point here is, if the patient is having multiple hernias, we need to check the gap between multiple hernias. So we need to check whether it is less than 10 centimeter or greater than 10 centimeter. Okay. So next, one more question. In the interview, they may ask you, how do you code if the patient performs one reducible hernia as well as incarcerated hernia in the inguinal region? Okay. So that time you need to tell them, I will code all incarcerated hernia repairs. So that is the CPT guideline. If the patient is having multiple hernias, we need to code strangulated or incarcerated as all hernias. Okay. So those are the interview topics while you are going to learn during our training. Okay. Next they will ask you, what are the approaches related to hernia repairs? What are the approaches, guys? Anyone?
Open,
Yes.
percutaneous,
Yes.
endoscopic.
Yes. Percutaneous, endoscopic both are same only. Basically, while performing the
Laparoscope.
laparoscopic approach, na patient will create.
Laparoscopic.
Yeah, perfect. Laparoscopic,
Robotic.
robotic. Okay. So in interview they will ask you. So we are having few set of codes where same code we will use for all type of approaches. Okay. So the answer is here, abdominal wall hernia repairs. Okay. So for anterior abdominal wall hernia repairs, if the patient performs open approach, laparoscopic approach, or this robotic approach, same code we need to use. So that is the CPT guideline. Okay. Next, one more interview question. So if the patient is having inguinal hernia as well as anterior abdominal wall hernia, and physician has performed two procedures or two hernia repairs, how do you code this scenario? Will you code one hernia or two hernias? And which modifier you can append here? Okay. So the answer for this scenario is, we need to code two hernia repairs. Why means anterior abdominal wall hernia most of the time occur in abdominal area. Okay, that is separate location. And inguinal hernias will occur in inguinal area. So this is separate location. So because of separate location, patient needs to perform separate incisions. Correct? So that time we need to code both codes. Inguinal hernia repair as well as anterior abdominal wall hernia repair codes. So like that, using these few lines, nearly we got 25 Q&A, correct? So in live coding, we are going to learn one scenario as well as guidelines related to the scenario. So those scenarios are very important for your interviews. Okay. Next, I will tell you what you learn during this live training. Okay. First, we will learn modifiers with example scenarios. Why means for interviews, modifiers are very important. Most of the time, 50% of same day surgery interview contains questions related to modifiers. Okay. So we will learn modifiers along with example scenarios. Okay. Next, we will learn NCCI edits. So if you go to interview, they will ask you what are NCCI edits. So National Correct Coding Initiative edits, which we will learn during our live training. Okay. So these first one and second one is more important for interviews. Modifiers with example scenarios and NCCI edits. Next, we will learn common surgical instruments. So why means if you want to learn surgery coding, you need to understand what are the common surgical instruments. By seeing the instrument, you need to understand what physician is going to perform. For example, if you see the scalpel. Okay. So what is the use of scalpel, guys? So other name for scalpel is blade. So basically using the scalpel, physician is going to perform the incision. Correct? So like that, we will learn all common surgical instruments. So using those keywords, you can code the live chat very easily. Okay. Next, we will learn types of incisions. Okay. Next, we will learn surgical positions. So as we have discussed previously, in CPT coding, we are having codes or procedures based on the positions. Okay. For example, physician will perform few procedures on the supine position. So supine position means face up. For example, physician wants to perform procedures on the lumbar area or back. So physician will place the patient in the prone area. Okay. So based on the position in the operative report, you need to understand that what type of procedure physician is going to perform. Okay. So we are going to learn all the surgical positions here. Okay. Next, we are going to learn OP report components. What are the components of OP report? Okay. For demo, I have used only 4 components like pre-op diagnosis, post-op diagnosis, indication, operation performed and description of the operative procedure. So we have used only 5, correct? Originally in the other way, nearly you are having 15 sections in the operative report. Okay. So in our live coding, you are going to learn each and every section elaborately. What is the purpose of each and every section? So what is pre-op diagnosis? What is post-op diagnosis? What are findings? What are indications? So how to identify the implants? All those things you are going to learn using OP report components. Next, choosing keywords from OP reports. So how to identify the keywords from the OP report? Okay. For example, if you see this operative report, if you want to code this operative report, you need to understand only 3 or 4 keywords. You don't need to worry about all these nearly 20 to 25 lines. Only 3 or 4 keywords you need to understand. That we will learn during our live coding. Okay. So this is very important if you want to code any type of operative report. Okay. Next, how to lead index. Okay. So each and every chat I will explain you how did I get that answer. Okay. So basically this is very basic. So I will tell you, just you need to go to your CPT book and you need to find the answer. Okay. Next, 3M software with WebPick. Okay. So in same day surgery coding, 95% of the companies will use 3M software with Epic. Okay. So in our training, you are going to learn 3M software along with Epic. So basically we will use Epic for documentation. So 3M other name is encoder. So where we will code the scenarios. And also using Epic, I will explain you how to provide the queries to the physician. For example, if you are having the missing path or missing OP report, how do you query the physician? Why means if you go to interview, they will ask you, do you have experience with 3M software or not? Okay, if you tell them I don't have any 3M software knowledge, they will not take you. Why means 95% of the companies are having 3M with Epic as the software for coding. Most of the time this software they will use for inpatient coding as well as the surgery coding. Okay. So here we are going to learn 3M software along with Epic, along with how to send the query to the physician. Okay. Next, in this session, you are going to learn nearly 40 to 45 live chats along with index leading. Okay. So these live chats consist of 10,000 series, 20,000 series, 30,000 series, 40,000 series, 50,000 and 60,000 series. Okay. Next, you are going to learn very important Q&A for interviews. Why means? So I have been started these sessions for the last 2 years. So whenever my student goes to the interview, they will send the questions to me. So I will collect all those questions, common interview questions, and I will prepare the answer. Okay. I will use those question and answers for my next batch. Okay. So like that, here you are going to learn nearly 700 very important Q&A for interviews. Okay. Next, you are going to learn updates related to ICD-10 CM and CPT 2025. Why means? If you want to go to interview, updates are very important. So whether it is irrespective of coding, whether in inpatient coding, surgery coding or SCC coding, updates are very important. So during our training, you are going to learn ICD-10 CM as well as CPT updates. Okay, like latest updates. Okay. Next one is I will provide 100% job support in India and USA. As you might have seen my posts in our groups, correct? So those are the jobs I have helped those students get job in USA and India. Okay. So these are the benefits you are going to learn using this training. Okay. And also along with this live chat training, I will provide dermatology training, orthopedic surgery training, respiratory training, cardiothoracic surgery, IVR, digestive system, urinary system, OBGYN, and nervous system and pain management. And also if anyone looking for videos, so those videos are also available for purchase. Okay. So during this training, I will provide the videos also. You no need to worry. Okay. So thanks for attending this demo, guys. Any questions for you? So first we will learn the guidelines related to chapter. For example, if we take integumentary system, first we will learn guidelines as well as most important interview questions. Then we will go to live chats. For example, if you want to code digestive system, first we will learn guidelines and important QA for interviews. Then we will code live chats. That is the procedure. So that is common for each and every series.
ఇక్కడ నుంచి స్టార్ట్ అవుతాయా?
So I am
Okay,
going
okay,
to
bro.
start this session this weekend only, Saturday, Sunday. And anyway, I am going to
Sunday,
post.
Sunday.
Tell you frankly, you no need to worry about that time. So you need to concentrate
Okay.
about how much I can learn, how to utilize me.
Mm.
Okay. So if you read well, if I follow my guidelines, if you are having any doubt, I may extend the session also. But mostly it will
Yes.
take 5 to 6 weekends. So why means for the last 2.5 years I have been performing these trainings. Okay.
Okay. So
Mostly
I
will
have a small
complete.
query.
Yeah, go ahead.